Senator Hassan.
Well, thank you, Madam Chair, and I want to thank you and the ranking member for holding this hearing, and I want to thank all of our witnesses for being here today. Dr. Gotts, let me start with a question to you. While Americans struggle to afford life-saving drugs, brand name manufacturers continue to increase prices. Generic competition can help drive down drug prices now. So how do new generic drugs affect brand name prices, and how much do generic drugs save consumers each year?
Thank you for the question. So significant savings is brought forth by the generics. If you look at the numbers over the last 10 years, we've saved $2 trillion, and $469 billion of that was in new generics that came to market. So it is a significant improvement and increase for the patients. We find that when one generic drug is approved, the price comes down about 50%. The generic price comes down 50%, excuse me, not the brand. And with 4 or more, it's more like 80 to 85%. So it's a significant increase in savings to the American patient and U.S. healthcare systems.
Thank you. Also, another question to you, Mr. Gott. For some medications with serious safety concerns, FDA requires manufacturers to set up risk evaluation and mitigation strategies, otherwise known as REMS programs. REMS helps to minimize the risk associated with these medications and make them safer for the public and for patients. For example, a REMS program may require prescribing clinicians to receive training on the risks of a drug and to perform monthly lab tests. Even though REMS programs are meant to protect patient safety, some brand name manufacturers have patented these programs to prevent generic competitors from entering the market. So, Mr. Goss, how have brand name manufacturers used REMS patents to delay the launch of generic drugs, and how have these delays affected drug prices?
Thank you. Thank you for the additional question. So REMS is a very important program, as you mentioned. It's about safety for patients, and it's a very restricted program in its setup. I would almost make it akin to new drug IRBs when they're doing the study process, so it has to be patient-specific, signed off, and given. REMS has really had two problems with it. The first one was we, as the generics, as we reverse engineer, need the product that we're reverse engineering to make that. The Decries Act helped solve that because we were being blocked from even getting the drug. We weren't a patient, we couldn't sign up for it, we wouldn't get it. So that's now been changed. But what's new is what you just brought up, and that's the patenting of the REMS programs. And so if the REMS program is actually patented, then I, as a generic company, can't get on that REMS structure to be able to bring my product to market. So it's a further delay of not months, but years.
And it's using the notion of patient safety to delay the development of additional drugs that could bring down the cost.
Absolutely.
Yeah. Okay, last question for you, sir. There is a long history of brand name manufacturers playing games with the law to delay and block the launch of generic drugs. As a result, patients pay more at the pharmacy counter, with some rationing life-saving medications because they can't afford them. And I would expect that every single senator on this committee has heard stories from their constituents about their decisions to ration their drugs and the impact that that has on their health. Mr. Goss, how are brand name manufacturers manipulating the system to limit generic competition?
Well, we just talked about two of those methods, and Dr. Cassidy brought up the point about some quasi-innovation, if you will, moving a product from twice a day to once a day, for example, and that in and of itself is not necessarily innovation, it's an improvement. But in that particular case, the physicians and the pharmacists can overturn that by having the patient go ahead and take the twice daily at the lesser price than once daily at the higher price point level.
Thank you. I yield my time.
Senator Burr.
Thank you, Madam Chairman. Carter, again, welcome. More than 278 therapies have been approved under the accelerated approval pathway